Hello everyone and welcome again to another Teacher Joseph podcast. Today we are going to look at a story from the Guardian newspaper which says women are paying thousands of pounds for private maternity care amid failings by the National Health Service. And we're going to read through this story. So it says here, people are paying thousands of pounds to hire private midwives amid frustration at the poor service many patients receive in the National Health Service, with women left feeling fobbed off and ignored. Now, just to give you some background to this, we have a National Health Service, of course, which operates our hospitals. And when you're having a baby, that's called going into labour. And when you go into labour, the National Health Service provides what they call a comfortable way for you to have a baby. You go to the hospital, there will be nurses who are specially trained in the delivery of babies. Now, these women who are specially trained in delivery of babies, they're called midwives. Today, that's a very old clinical practice. But in the old days, to be a midwife was usually something the elder women did in the community. There were women who were specially trained, not because they had medical knowledge, but just because they were big, strong, and had maybe 10 kids themselves. These days, though, you can still hire midwives privately. I guess they would be medically trained these days compared to the past. And what it's saying here is that many women are having to hire these midwives privately because the service given in the hospitals just isn't good enough. So it says here, growing numbers of women are paying up to £8,000 for maternity services, adding to a surge in people going private as the National Health Service struggles to provide swift and safe care. Yeah, so there's been an ongoing debate here about our health service and what it's actually capable of doing. It says here, last month the Parliament found women in labour, that's women who are going to have a baby, they have been mocked, ignored and left with permanent damage by the National Health Service midwives and doctors. The UK's first inquiry into birth trauma found poor childbirth care was so common and its consequences so damaging that ministers and National Health Service bosses needed to push through significant changes. And then the story goes on just to tell us more about one particular hospital which has been named as giving a particularly poor service. It then says that the Portland Hospital in London is the only privately owned maternity hospital in the UK, and giving birth there starts at £7,495 for a typical delivery. It's saying that it has seen an increase in expectant mothers choosing it. And it says, we're finding more women also want the guarantee of continuity of care, which we provide. There's someone here called Jackie Tompkins, and she's an independent midwife for more than 20 years. And she's saying that inquiries have doubled from 2 to 5 a week after the pandemic. And she says lots of women were looking for extra support. So the role of a midwife is very interesting. They are basically kind of like coaches for people who are going to have a baby. They're there to help you medically, and they're also there to encourage you and motivate you. And that's something I think which hospitals are doing less and less. It says here, if a woman is birthing at home and things look like they need a more medical approach, then we can transfer them to a hospital. It says here, this is the story of another lady. Catherine Wilson, 32, had her first baby at home last year, helped by an independent midwife. She says, I knew before I was pregnant I wanted a home birth. Every National Health Service midwife I spoke to was positive, but I knew there was a good chance they wouldn't have a team available when the time came, and that I would have no choice except to go to the hospital. So choosing to invest in a midwife, so she means a private midwife, she says, I could get to know throughout my pregnancy, I could get to know the woman, and someone who was guaranteed to come when I went into labour. And then she says she was hugely privileged to make that choice. Then she says the same midwife came to her home more or less every week from about 20 weeks. When the time came, she and a colleague came within an hour of asking for help. And she says it was calm, empowering and joyful. Well, it sounds like this woman who's telling this story is indeed fortunate, because she's obviously educated enough to use these very powerful words, calm, empowering and joyful. Okay, so it says here, my experience has left me wanting to change the narrative around birth being painful, messy and undignified. Okay, so this is all very, very nice. I would say, this is just my own little opinion, okay? I would say that this is another very good example of where we simply look to the government to fix this. As I've been saying in this podcast a lot, we often just go to the government and say, oh, you need to do something. You need to fix this. But actually, if there are people out there who can afford to pay £8,000 for a midwife, then why not just do it? It's clear that we can't keep asking the government to fix everything, although historically, of course, having babies was very much the responsibility of our local hospital. But only 100 years ago, women didn't have that privilege. Women, of course, they had to have the baby at home, whether they wanted to or not, unless there were complications, because there simply weren't enough hospitals around in those days. So, I don't know. For me, I would say it's very good that people have the money to pay for private healthcare when they most need it. And of course, there should always be healthcare available when there's emergencies, or for women who prefer that. But again, I don't think we can just keep going to the government with these issues saying, oh, well, you need to fix this. Because sooner or later, our government is going to run out of money discussing time after time things which perhaps as a culture or as a community we're able to fix ourselves. So maybe it's just some common sense. If you have the money and you can afford to go private, well, maybe that's just what you have to do, and leave the hospital for those who are less fortunate. So that's a story from today about women who are having babies. Now, this is very interesting because our health service in England, remember we have these 4 nations, they all operate very differently. So in England, the health service is divided up into different areas. So you have, for example, NHS, National Health Service, Cheshire, NHS for another area. And so it's very hard to see whether they all take the same approach. But we're just going to continue reading this news story. So it says here, Cheshire Hospitals, NHS Foundation Trust, because as far as I'm aware, the English ones are in partnership with private companies. Mid-Cheshire, Cheshire being an area of England, Mid-Cheshire Hospitals NHS Foundation Trust does not have private maternity services, but lets women pay for private rooms to stay if they need it. The number paying for those rooms rose from 1,470 in 2016 to 6,100 last year. And then there's another NHS area which is called Great Western. I'm assuming that's around Bristol. It says here they also have private rooms, and income's gone up by charging for those. And in Surrey, which is a affluent suburb of London, it says here they also have had private consultant-led births, and income from that service gave them a lot more money. So clearly for hospitals, they can make a lot of money out of offering services to private people. So let's see. That's opposed to offering services which are public. So if they offer a private service to private people, of course, they make money, or they can offer a public service to all of us. It says here, another large trust, Imperial College Healthcare NHS Trust, it bucked the trends. It says here, private patient numbers were down from 1,100 in 2018 to 916. So it's the opposite. If you buck the trend, you basically prove that it's wrong. Yeah, and then it's just saying that they are noticing a substantial increase in women seeking private services. And it goes on to talk a little bit about that. Of course, we have an election coming up, so this is a big issue. And it says here, the rise in these kinds of things see many women deciding that they don't want to have anxiety. And of course, our government and the shadow government, as I was mentioning yesterday, are rushing to find solutions and alternatives, not only to help, but of course to make themselves popular in this coming election, which is coming up in July 4th. So there we are. That's today's news story. So I hope you found this helpful. Let's talk soon. See you. Bye.